Right, hello everyone. My name's Heidi and this is Stuart and we are podiatrists
G'day.
at LBG Medical. We're just going to spend the next few minutes just talking through and having a little bit of a chat about the custom footwear. So I think because of the time of the year we're going to focus more on the custom slipper. And I think probably one of the main things to say is obviously our gold standard is your perfect custom made orthosis that you put in a perfect shoe which your patient wears all of the time. But really, as anybody that's been practicing for any amount of time knows, patients just don't always do as they're told, really, do they? And this is really where this kind of thing comes in.
This is right.
So we've all got those patients that go home and they don't wear their orthoses or they don't wear the shoes they should wear. But then I think you also get the patients who are very, very diligent and they don't realise they're not being compliant. And I think this, an example I can think of a few years ago, I remember seeing a chap who'd had I think it was an ACL reconstruction, had quite a big limb length discrepancy, and we sorted him out with orthoses and heel raises and everything, and it worked really, really well. Then his job changed, he worked in IT, and then he was working 3 days a week from home. And then everything started basically not working, and we couldn't work out what the problem was,
Classic. Yeah.
what the issue was, and he was like, but every time I go out I wear them, when I run I wear them, and then we realised when he worked from home, he was clocking up the miles around the house, going upstairs, downstairs, back. He was a bit of a fitness freak. And it was literally because he was slopping around in his slippers all day. So anyway, at the time, and I'm going back about 15 years now, at the time I modified the slippers he had, put heel raises on, stuck a bit of medial wedging in. Didn't look very nice, I must admit. But it was a compromise and it worked really, really well. And I think this is really where this sits, isn't it?
This slipper and its cousin, the sandal, come into it.
And I think especially with probably your little old ladies as well, they don't want to wear trainers around the house, do they? They take leave their orthoses.
The young fit men who are in the football club, rooms, they don't want to acknowledge that they've got an issue, so they'll just flop around in the
whatever they've got
in the flip flops, and that causes ongoing issues. So this is a way to help identify them out of. Not all devices need to be something that's absurdly modified to what they would normally wear. So Strive.
Yes.
We all know our clinical challenges when we're in there. So it's all about engagement with our patients, trying to get them to wear, as Heidi was saying. So this process, the solution that we've come up with a slipper.
With the sort of inbuilt orthotic sole.
That's right.
So I think the key point here is it's the footbed which you prescribe. So that's the bespoke bit, that's the prescription bit. But then we put a standard upper on. So we don't do anything to the upper, so we can't make that wider or put any lumps or bumps or anything fancy on the top. That's
right.
It's literally a standard Strive upper.
And then the sole that's pressed onto the base of the customised portion of the device, which is also a standardised thing. So there is some limitations compared to what you would get with a fully customised device, but acknowledging that and working with what we can work with in the time that we're going to be in them.
Got some really good results actually.
That's right.
So we do have a separate prescription form for this. There's a little bit less on it because there's less that you can do with the custom footbeds. So essentially you've got the choices of whether you want a medium or a high EVA. So this part, your footbed. Generally speaking, I mean, our medium density EVA is quite substantial anyway,
so
isn't
it's an A50 short.
Yeah.
So
I think unless you've got someone very, very heavy or really, really, I don't know, heavily, excessively overpronating, whatever term you want to give it, most of the time, and we find probably 80-90% of the prescriptions we get in a medium density. It's then very important that you put the shoe size, and if you carry a stock of Strive footwear anyway, I'd probably get your patient to try on the shoes first or the sandals, because patients do lie. I'm a size 5, and actually they're squeezing it in, and it's a size 6.5. We have a footbed sizing kit as well, which we don't actually have here, but we can send those out to you if you require, and that's quite a good way to make sure you get the correct size, because the only thing with this is once we've made it and sent it to you, it's then, well, we can't change it. So it's very important you get your prescription and your sizing right before you send this in. So you've got your choices. We've got the sandals on there as well as the slippers, so you choose your style, choose your colour. But there's some quite good little things you can do with the prescription. So we can do a lot with the arch profile, so we can do with the normal no addition and standard 3mm or your extra 3mm, so we can higher or lower the arch accordingly. And then we can put rear foot posting in there as well. Now, we recommend you don't go above 8 degrees, don't we?
Just creates too much problems for the restrictions that we may have with the upper when we're putting the upper on. Once we go past that 8 degree rear foot support, it negates any use that we can put back into the shell.
Yeah. And also because these don't have backs, I mean, they've got a good stable heel cup in,
yes,
but the higher you go, the less you kind of got to hold it all in.
That's right.
So if you start putting things in like 10, 12, I don't know, 14 degrees, and it has been asked for, then your patient is more likely to slip out the side because you just haven't got that lateral support, which you would get with your proper fitting footwear, which you'd recommend with your custom orthosis. And one thing we can do with it, and I don't know if you can see it on the video, is we can put Kirby skives in, and they work really nicely when you want that added bit of extra control. So you can put a Kirby skive in there. We can also put heel raises, but again, we wouldn't recommend going above about 5 mil because again, that takes it out of the heel cup. So anything more than 5 mil, I think you're looking at going to a cobbler and getting something extra put on the bottom there. 4-foot posting we can put in, but we wouldn't recommend going more than about 4 degrees we've put on there. And again, that's because it's just going to take up bulk in the shoe. And we can also put all sorts of padding in there. We can do first met dales, fifth dales, or if you've got a neurovascular corn underneath the second or the third, we can do a cutout under there, as long as you mark it clearly on your prescription form, and also your cast where you want that.
Definitely.
What works really, really well, we've had a lot of feedback about this, is your patients that have got first met pain. So maybe your bunions, your first MPJ, OA. What can work nicely is when you've got a met dome in there, which I don't know if you can see or not, but if you combine a met dome with a first met dale, then that drops down quite nicely and gives you almost like a functional hallux limitus modification within the sandal. And then coupled with the fact that you've got a rocker underneath the sole there, you've almost sort of hitting it from...
You're kind of approaching it from 3 different
angles, really, aren't you?
So not a complete solution, of course, but it's a really good solution for the use that we can see that patients put them to.
So I don't know what else we can say.
They're one of these wonderful things that the more we see of them and the more we hear back from your clients, the more pleasantly surprised we are about the overall effect that they have. But please engage with your customers to know that this is part of an adjunct to the complete therapy that you provide, and we're here to help you provide that.
I mean, essentially, it's increasing their orthotic wearing time, isn't it? So when they go out of the house, they've got their orthoses in their boots or their trainers. Then when they slip out of that into their house shoes.
Yeah, and technically the only time they're not in the shoes that you provide them is when they're asleep.
Hopefully. Probably looking at doing a men's range as well, aren't we? Although when you look at them, I mean, they go up to a size 9, 8 or 9?
Yes, female size, yes. But we are definitely, I'm not sure when it's coming out, but we're definitely looking at a small range of men's shoes early in the coming year.
And then don't forget as well, when the summer comes, we do have a range of sandals, which you can also put these custom footbeds into or prescribe them into. And that works really well for your patients that are going on holiday and they just don't want to be wearing closed-in shoes.
Yes, we all do that.
So any questions, give the evaluation team a call. Ask us any questions you like, but I think we've pretty much covered it. But I think the take-home message is this is a compromise and it works really, really well for moderate control.
That's right. Helping to spread your therapy. And those patients that are resistant to the change or engaging with the treatment program that you've put forward. And this is really just shows that it doesn't have to be what the patients think they are. We can bring it into a really nice range of slippers and sandals that has quite a good clinical effect.
Right.
Thank you.
Look forward to hearing from you.
Cheers.
Thank you. Bye-bye.